Romantic relationships come with their fair share of ups and downs. And I think it's fair to say everybody that begins or is in a romantic relationship, you're going to have days when you go up and down, think about the relationship, and you may even be called obsessive if there's one particular situation going on and you end up spending a lot of time thinking about it most of the day. However, there is a disorder, and it's a subset of OCD, obsessive-compulsive disorder, and it's exclusive to relationships. So it's called relationship OCD, or ROCD. And what happens with that is all of your mental focus goes to the relationship. You begin getting obsessions, and these obsessions revolve around doubts about one's feelings for their partner, the feelings of the rightness of the relationship, and just how secure they are, how sure they are. It's 100%. And though this is not formally listed as a distinct diagnosis in the DSM-5 revised, I think it's widely recognized, and among clinicians, especially who deal with relationships, and the manifestation of OCD with a specific relationship context. So I want to go through some ways that you kind of can see the tapes, the self-talk going on, so that you can recognize it if you or your partner are dealing with this. Things like, do I really love my partner? Is my partner attractive enough, smart enough for me? What if I'm settling? Am I truly happy, or am I just afraid to be alone? What if I don't feel the same way tomorrow? These are the obsessive thoughts that begin churning. And then I think these thoughts are kind of ego dystonic. So what happens is they feel alien to the sufferer's values and identity. So usually the person having these feels pretty good about themselves. They're comfortable in their own skin, but for some reason this relationship begins this kind of talk. So in a way, they think of it as acute, and that's what scares them, makes them think that there's something really negative going on. Now, typical compulsions are a lot different. They're more like constantly seeking reassurance with friends or partners, mental reviewing past interactions, or proof of love or compatibility, comparing their relationships to other relationships, testing their feelings. They many times ask, do I feel love when I look at them right now? Avoiding intimacy or closeness for fear it will expose some truth. But the way that our OCD is different is that the key features are there's significant distress and impairment in their daily actions. Like they can't get these thoughts out of their head. These obsessions and compulsions that are time consuming are more than an hour each day, and it's a consecutive hour. There's a marked sense of urgency or a crisis around resolving the doubt, so they're trying to test it quickly. And they may persist despite evidence or reassurance from their partner. So what are the causes? Why does this happen? Well, there is a genetic vulnerability. If you've had a parent or a close family member who has had things like this before, then you're more inclined or more susceptible to suffering from it yourself. There's a neurological difference in brain function and cognitivity in these people. There's psychological factors like perfectionism, intolerance, uncertainty, or fear of making mistakes. And there's a cultural or family influence, especially around the romantic ideals or the emotional expressions. I'll see this more likely when different cultures fall in love, and then the families of each of those cultures, if they have negative ideas about the culture their son or daughter is getting involved in, many times the person in the relationship will have more of this relationship OCD. They're trying to get a guarantee in their own mind since the parents may be against it. The gold standard for treating any of this relationship OCD is cognitive behavioral behavioral therapy. And that's because there's an emphasis on exposure and response prevention. So when you get triggered, helping you find more logical things to do instead of overreacting or ghosting the person or leaving or breaking up, because that's not always in your best interest or your partner's. The key treatments are to learn how to tolerate uncertainty, to reduce the compulsive behaviors you're having as a way of acting out, and then challenging the distorted beliefs. And the distorted beliefs are most of the beliefs that is causing the person to have these compulsions that they can't get over, that just keep going around in their head. Sometimes medication is indicated. Doesn't mean you're going to have to take it forever, but certainly through a crisis time. And avoid any kind of excessive reassurance. The supporting person that's with you should really try to do less of that excessive reassurance and challenge the person's thoughts instead, which is difficult for couples. But if you can do that, you're going to help your partner work through this quickly. Learn as much as you can about OCD, not only for the person who is with someone who has this, but also for the person who has it themselves. And practice patience and empathy without reinforcing the compulsion. I think when you practice empathy, when you remind your partner, listen, this isn't beginning and now we're into it. There's a process we have to learn how to work together, how to go through this together. And the more your partner feels you are a teammate, the more the assurance that's going to give them, minimizing those compulsive thoughts, making them feel like they can trust you more. If this video is helpful for you, please subscribe. And if you're already a subscriber, thank you so much.